Assalamu alaikum warahmatullah. I hope you're all well. Dr. Lekorman from Ireland. As I mentioned in my previous video regarding MSRA exam, a unique opportunity with thousands of training slots for international medical graduates. They can attempt an exam which is called multi-specialist recruitment assessment exam remotely anywhere, especially I'm talking about Pakistan, my colleagues. And this video is very important in a way that I spent a couple of days to find out answer on the eligibility criteria. There are certain gray areas where I couldn't find an answer. If someone is not holding a GMC, is that person eligible? This is what the question I have been looking for. I watched many videos on the YouTube, the people who have made previously. No one gave a proper answer on that. And I found two resources on the GMC itself. And then my assessment as per understanding that I'm going to give you that at the end, that whether you are eligible to apply for to appear in exam. There are two different things I will be using in that. Number one, can you apply for MSRA exam? Yes or no. Number two, can you start the training? And when you start the training after passing the exam, are you eligible or not? Two eligibility criteria for MSRA and for starting the training. These are two different things and I'll be addressing that. So let's come on to the GMC website. So I have opened it already for you guys that if you write down on Google General Practice ST1 2025, if you write down this information, you will come on this site and here you will find one thing which is called eligibility criteria. You can see that clearly here. Eligibility criteria, selection criteria. There's two different things. That's what I'm talking about. Eligibility criteria is different to appear in MSRA exam, and selection criteria when you're going to start a training, that is a bit different. Let's come down eligibility criteria. As I have made videos for the Irish training over there, basic specialist training in Ireland. So eligibility criteria is almost same to apply. Applying is different and to start a training is different because their foundation year, interns, they complete their rotations near to the start of training. The August is the time when 2025 when the actual training starts. So they make such criterias where they can fit their interns into that. So number one, qualification. Qualification is very simple, MBBS, and I'm pretty sure my colleagues, international medical graduates, they have MBBS from a university or a college which is registered as per their GMC guideline. Number two, registration and right to work. So if I read out loudly, be eligible to work in the UK, you must be eligible for the full registration with the whole current license to practice from GMC at the advertised post start date of vacancy, which is August 2025. So by that time you should have a GMC if you get the chance and you avail the training slot to MSRA exam. By August 2025 you should have a GMC. If you don't, then your training will be skipped. Number three, meet the standard set on GMC, good medical practice. Fitness to practice, if you fill the application form, which I mentioned in my previous video, they will ask all the questions, good medical practice, any fitness to practice issues. So you will be highlighting over there. And definitely you must not have a CCT of the GP training before. So this is very simple. So career history that is something that when you fill the application form and you put the employment history, so you need to mention any gaps and you need to give some clarification as well. Okay, this is something. Let's see that disclosure of CT and ST1 entry. Okay, you must complete all sections of application form fully and truthfully in accordance with the written guidelines. All right, You must disclose. This is the same thing that I mentioned, that when you're filling the application form, so all the details that you need to mention, whether in UK you had a foundation program you started or not, if you had started, did you complete or not, or if you have started another training program in UK and you resigned from there, or they expelled you from the training program. So you need to write the clear information when you're filling the application form. This is where I want to bring your attention, competency and capability assessment. Let's come into that. So look, you must have evidence of achievement of foundation competencies in 3.5 years preceding the advertised post start date for the vacancy via one of the following 4 methods. This is one of the important thing in this whole video to be focused on. And also I'll show you another link where it is very clearly addressed. So foundation competencies, the UK's intern, whatever competencies has been mentioned in their guide, so you have to provide that if you are coming from internet as an international medical graduate from abroad. So there are like 4 categories, 4 methods. Number one, if you're doing a UK foundation program, okay, so if you're working in UK, that's fine. So current employment and GMC approved specialty training, if you're in a training post, okay, fine. A foundation certificate from the UK affiliated foundation program. So if you're not working in UK, there are certain countries where UK foundation program exists, like Malta, like in Malaysia. So they give you this certificate, FPCC. In Pakistan, no of UK foundation program exists any affiliation. So this is not for international medical graduates who are from other countries apart from Malaysia, Malta, and some other country. 12 months. This is one thing that you need to focus on. 12 months medical experience after full GMC registration, or equivalent post-licensing experience and a certificate of readiness to entry specialist training. Now, this point is very tricky to understand. So they're talking about if you have been working on a non-training post in UK, which is my understanding, then definitely you have GMC, full GMC obtained, and you have 12 months post GMC experience or equivalent post licensing experience. For example, you have a licensing experience in your own country and you have 12 months experience post to that. So people say 24 months experience because in UK foundation year is pre-registration 12 months and post-registration 12 months to 24 months. So I presume that in our countries it is 24 months that experience that you need to provide. This is what I have heard in different videos as well. So I will clarify this point with another link which I'm going to show you. So if you go further down, general practice special eligibility criteria, it is the same that you have seen up all things. There is nothing different down. I can show you, but I'll go to the another link there. So this I have seen from when you fill the CREST form. Evidence of foundation competencies application guide. This is what I have extracted this information from. Now, the questions they have answered in the frequently asked questions section, they mentioned I have been working abroad where there is no foundation program, which is like Pakistan or other international medical graduate countries. What are likely to be deemed appropriate posts for me? Here I could see some clarification. So they say 12 months satisfactory completion of either pre-registration. So basically they're asking you 12 months of internship. So they have defined the internship rotation down in the link, but 12 months internship and then 12 months full-time certificate completion post. So total 24 months internship plus another 12 months in medical education in the post approved for the purposes of medical education by relevant authority. But I think we are fitting in the second one, that 12 months internship plus 12 months full-time experience at a publicly funded hospital in at least 2 specialties with acute medical responsibilities. This thing you need to highlight. 2 specialties with acute medical responsibilities. So it can be surgical, it can be medical, it can be obs and gynae, pediatrics, anyone. It's fitting in that. And this is what the international medical graduates has to provide the post. So here they haven't mentioned any GMC 12 months, but over there they have mentioned 12 months post GMC registration or equivalent post licensing, which I could clarify from here. But I could clarify one thing to you. You can email them always and get confirmation. There are two different categories, as I mentioned in the earlier part of the video, that the eligibility criteria to apply for exam, MSRA exam, is different, and eligibility criteria to start the training in August different. So you don't need to have an active GMC to apply for MSRA exam, but you need to have a GMC active when you want to start the training. You must have understood the difference now. So here they have mentioned that what posts are eligible, 3 continuous months in duration, clinical experiential environment, or the post the certificate refers to must be. This is what the referee's information basically has been completed 3 months and has been completed 3 continuous months by the time of submission deadline, have been undertaken within 3.5 years before commencement of the post. This is a very important point. So 3.5 years at least when you are getting a crest form sign or foundation or internship, and the post that you are asking the referees, I'll talk about the referees on the crest form separately. They need to you need to have a 3 months continuous work under them, and this work should be within last 3.5 years before the commencement of the post, which is August 2025. So clinical attachment, observership, unpaid work does not count. You can go through this yourself for the full detail, and I'll recommend you to go through this. And internship, basically this is the point I need to make. So 12-month program that includes a minimum of 3 months in surgery and 3 months in medicine. A program at least 10 months duration that includes minimum of 3 months in surgery, 3 months in medicine, with an additional study period of up to 2 months, the equivalent of 12 months full-time post-qualification at publicly funded hospital in at least 2 branches of medicine, which they have mentioned up. So in short, in summary, 2 different criteria. One is to apply for exam and one is to start the training. And to apply for exam, you need to have 2 years at least experience. 1 is house job and 1 year post house job experience, which where supervisor signs off you that your competencies are equivalent to the foundation year program candidate competencies in UK, and that is all available on the crest form. So my next video will be on the crest form, that what is the crest form and what are the frequently asked questions in the crest form and how you fill that crest form and what are the prerequisites. This is very careful to be submitted and to be filled out that form. Let's see you in the next video. Thank you.